unique because we have a very unique melting pot. And the last time I counted is about 70% of our population have either Asian ethnic background or have a mixtures of ethnic backgrounds. And so that kind of gives us a bad modularity because we are #1 in cancer rate in the United States. And we are seeing that liver cancer as working in the liver center and the transplant program is increasingly had to deal with patients with liver cancer. And the majority of them were from hepatitis B. And one of the reasons why this is happening is because we don't have a lot of knowledge about hepatitis B or for that matter hepatitis C in the community. Because in the first 20 to 30 years of their illness, there's no symptoms. And only when they get into trouble at the end of a disease progressions that they will be realized that they have hepatitis B, and sometimes it's too late. So today's agenda, we're going to have kind of 3 perspectives to address the issue on hepatitis B. The first one is from 2 friends of mine who are practitioners in this community, Dr. Haman Lam and Dr. James Gumet, which will introduce them to come up to talk about their practitioners' perspective in terms of hepatitis B.
Viral hepatitis B is the bad guy. This can be contacted mostly, through body fluid contact. A lot of my patients got their disease from the mother, and some people think that mother carried the virus in the body and transmitted to the baby inside the mother, but that's not true. Actually, the contamination is the way to transmit is through contamination. So hepatitis B virus is a big virus. It cannot pass through the placental area, so it does not transmit from the mother's blood to the baby. So actually, during childbirth, so childbirth contamination, the blood, body fluid. So you have a family of 5 people, you screen them, 2 or 3 might be positive, maybe 1 or 2 is negative. You gotta wonder why, because we just didn't get it that way. Okay, so of course, sexual contacts, through sex. Hepatitis B sometimes cause acute infection, and some people not even feel it, and they develop an antibody to the virus, and a lot of them develop long-term problems. Then when the virus it become a carrier. When the virus in the body can cause inflammation, and then it can cause fibrosis. Fibrosis is scarring of the liver, and then more scarring and can lead to cirrhosis. Cirrhosis is replacing the normal tissue by scar tissues, and blood flow become a problem, and so the liver don't function right, and so the cirrhosis, and then the worst is liver cancer.
So how can one find out whether you have hepatitis B or not? I guess because it has no symptoms. So the only way you can find out is by doing the test. So testing is crucial, and the CDC recommends, for instance, that all individuals born in the area of high prevalence, and such as in Hawaii as well as in the Southeast Asia, be tested for this disease. And basically about 2/3 of people infected don't even know they have the disease. So that's, and those who know, approximately only 41% actually see the doctor for the condition. among those who tested positive, only one half are treated. So basically, the question then is, how do you get the people to get the test? So that's very simple. And many patients tend to think that they're healthy, they don't want to see a doctor. And so it behooves for us to actually encourage patients to get it tested. So in summary, how do you combat hepatitis B? The first thing to do is to get it detected. And the tests are simple, and most physicians can order the test, but the patient has to go to the doctor and ask for that. The disease is preventable, and at this time, the vaccine is available for more than 30 years. And finally, the disease is manageable, so they can be controlled with medication, and it will likely decrease the complication from developing into liver failure.
Thank you everyone for coming. Like Dr. Desai said, I'm Thaddeus. I work with the Department of Health. I am not a doctor, but you can still trust me. So I'm going to talk a little bit about hepatitis and what we're doing in Hawaii for our communities here. But first, I'm just going to ask you guys, I know it's lunchtime, to just do a little activity with me. It's something we do with our community members. So if you can all stretch your left hand up in the air, just stretch it for me. That's good, you all know where your left is, that's good news, okay? And then stretch your right hand, very good. Put it on your rib cage, put it right there, and say good morning to your liver. So that's where your liver is, right over there. Good morning, Miss Liver. I know we talked about the liver today, and I wanted to kind of show you where it is. Hopefully you don't feel it, but I'm not a doctor, but trust me, it is there. And the reason we do that is to kind of really show that we all have livers and hepatitis impacts every one of us, right? We're all part of the community in Hawaii. And so when we talk about hepatitis, we're talking about liver cancer, we're really talking about the people that we know and love. So what we do in the community is really going beyond just interacting with one patient and trying to see how we can keep all of our communities healthy, especially folks who are Asian and Pacific Islanders, which is a lot of people in Hawaii. So what do we do in Hawaii? Well, with Hep Free Hawaii, a little summary here, I call it raising the bars. Because if you think about it, there's a lot of things to be done for hepatitis B when the doctors are presenting. We have to increase testing, we have to increase vaccines, we have to increase access to doctors and treatment. So we have a lot of bars to raise up. And how do we do that? We're gonna ask for your help to raise awareness and also raise access. So by raising awareness, by talking to the community, we can really increase access as well. And like the gentleman in the back pointed out, this is not only what we're doing in Hawaii, but also on the mainland. So we partner a lot with folks in DC, with San Francisco, LA, to really make sure this is a national and a global effort.
2008, I was diagnosed with hepatitis B. By 2009, I returned back to the Marshall Islands, not knowing what to do. The doctor was telling me that I would have to be careful. Marshall Island, knowing that Marshall Island health services lacked the treatment and diagnosing, screening and all that for hepatitis B disease. So that was really a scary thing during the period of time, because there was no way to communicate between the doctor here and the one in the Marshall Islands. And also the doctor in the Marshall Islands were not really specialized and not really knowing what to do to help me during the period. So good thing I was working for the cause of the Marshall Islands, and I had the opportunity to travel through the United States for training and all that for the college student services program where I was supervising. So during the period I was kind of back and forth between here and the Marshall Islands, I was able to see my doctor to follow through while I stopped by here. And so that was a really great opportunity to kind of touch base on the chronic already, the happy disease that I had carried around. 2011, I moved to Hawaii to seek better health treatment. Right on the spot, my doctor told me that he will have to refer me to the specialists who are handling the case because it's already worse. And I want to take this opportunity to personally thank Dr. Sai and Dr. Linda Wong. They are the two that they were in charge and were able to perform the transplant.
The question is about what the liver do for us in terms of health and illness. Liver do many things. Number one, they produce a lot of elements that our body needs, including proteins and correct coagulation factors. Number two, they help us to clean our bodies. So any waste products that we produce, the liver is in charge to get rid of them. They get rid of them through the GI tract or the gut. They also help to get rid of them through the kidneys. So it's a very important organ. And the third thing is that they produce antibodies, they produce chemicals that can help us to fence off any infections. So if you don't have liver or a bad liver functions, people get sick. And one of the chemicals that is very important for us to get rid of is the product called ammonia. And ammonia comes from protein production. So if we cannot get rid of the ammonia, it would affect the brain. So it becomes very confused, and some people go into coma. So without liver, our body can go crumbling down, including the brain functions, the heart functions, the kidney functions, and eventually our bowel functions. So it's a very important organ. And hepatitis B is a virus that will continue ongoing injury to the liver. Our liver is a very great organ because whenever they get injury, they recover, they regenerate. But the problem with hepatitis B is that they are always inside the liver and they continue to damage the liver over 20, 30, or 40 years. During that whole process, the liver becomes scarred. And when they have more scar than the normal tissue inside the liver, then the liver lost all the functions that I mentioned about. And that's when they need to be transplanted. The other is they can create cancer. The hepatitis B is, in the world, #1 reason we got liver cancers. And you know that if you got liver cancer, your chance of survival goes down very dramatically. And so in health, in illness, liver is the most important part of your organ.